Hi, I'm Eve Martin. I'm a sophomore at Oglethorpe University. I am majoring in biology on the pre-med track, hoping to go to medical school after my 4 years of undergrad. Today my topic is on dopamine and cannabinoid 2 role in helping schizophrenia. I came to this topic because I've always been very interested in mental illnesses and how the brain works when it comes to causing it, or in some cases helping it. And as I was doing research for my short talk, I knew that I wanted to do something relating to mental illnesses. And I was starting to see that with schizophrenia, it was a lot of research on it, but not many known causes of why it happens. So I thought it would be very interesting to find different ways that scientists are trying to actually help it. So to start, I'm just going to give some background on schizophrenia, what it is, what causes it, what the dopaminergic system is, specifically D2 and D3 receptors, just some bigger questions that my research studies that I found asked and what I asked in order to come to this topic. And we're going to get into those researches to better understand schizophrenia. One of them is testing dopamine's effect on schizophrenia, and another one is just more effective ways to find more effective medication for it. So we're going to be looking at dopamine antagonists and CB2 receptors. So to start, schizophrenia is a mental illness. It affects how a person feels, it affects their thoughts, it affects their actions. And like I said, the exact cause of it is not known. But scientists do believe that increased dopaminergic activity do play a role in it. So basically, too much dopamine release in the brain. So outside of the regular release of dopamine, too much of it. These people typically lose touch with reality, and if it's not treated, it can become disabling for them in daily life activities such as forming relationships, going to work, going to school, and it is split into 3 different types of symptoms. We have psychotic, negative, and cognitive. And you're considered diagnosed with schizophrenia if you have 6 months or more of showing any 2 of these symptoms. To start, psychotic symptoms are considered when people are having altered senses, abnormal thinking, odd behaviors. Like I mentioned, when they feel like they lose touch with reality. When it comes to psychotic symptoms, these people, they experience the world and themselves in a very distorted way. So you could think of a person hallucinating, hearing voices, seeing things, or being paranoid, thinking that someone's out to get them, or if they hear like a radio talk, they think that that person's specifically speaking to them. And sometimes their speech is very disorganized because their thoughts are all over the place. Negative symptoms, these people typically lose motivation. They don't have any interest in activities. They don't want to be social. They have a hard time showing their emotions. So you can think of like they're not able to really start tasks and they're not able to keep up with a task if they do start it. And they don't speak a lot. They just don't feel any pleasure in life at all. Cognitive symptoms, on the other hand, are very less much seen than psychotic and negative symptoms when it comes to schizophrenia patients. But when cognitive symptoms are seen, these people have an attention problem, they concentration problem, memory problem. They have a hard time making decisions, and it's very hard for them to remember things, especially like right after they learned them. So schizophrenia can be seen in your late teens, early 30s. Mostly men get it, and it's seen at a very much earlier age than it is seen in women. So what causes schizophrenia? Scientists do believe that your genetics and your environment can play a part in it. So it can run in your family, but no one specific gene just causes schizophrenia that scientists know. They do believe that living in poverty, stressful surroundings, virus exposure, or nutritional problems at birth can also have an effect with it. And they also believe that differences in brain connections and differences in the amount of brain components, such as neurotransmitters, and in this case, we're going to be looking at dopamine, play a role in causing schizophrenia. So because we're looking at dopamine, the dopaminergic system is very important. It is considered signal transduction pathways, which are basically signals that are sent between cells. So molecules will bind to receptors. And in this case, dopamine is the molecule and they bind to dopamine receptors. And each dopamine receptor is for a specific function. Some of them have the same functions, but one does what another can't. And our dopamine receptors are very essential in our life because they help us in movement, they help us in our emotions, in our reward pathway. And there's 5 different types of dopamine receptors. And the 2 that we're going to be focusing on is D2 and D3 receptors. Our D2 receptors are involved in our movement, involved in us paying attention, involved in us sleeping, making memories, learning new things. And our D3 receptors are more involved in our thinking and the impulses that we make, but they are also involved in our attention and sleeping like D2 receptors are. And all of these are connected to our positive and negative and cognitive symptoms of schizophrenia they happen due to different types of dopamine pathways. So as you can see to the left, the image shows the different pathways that causes schizophrenia symptoms when there's too much dopamine released in the brain. So just some bigger questions is, how does dopamine affect schizophrenia? So we know that scientists know that increased dopamine does play a role in causing schizophrenia, but they don't know specifically like what symptoms it can cause because there are different symptoms. So some studies get into ways that dopamine affects schizophrenia. And then another bigger question is, what can be used in finding a more effective solution to schizophrenia? This is more so a question that I asked myself, but 2 research studies that I found also were working to find the answer to this question. So I found a research article by Watson et al. And basically they hypothesized that blocking D3 receptors actually reverses people who have low memory and hyperactivity, which are 2 symptoms of schizophrenia. So not being able to memorize or being all over the place. And this was very interesting because most of the articles that I did find focused on dopamine 2, but in this case, they focused on dopamine 3. And it was very interesting to find this because the antipsychotics that treat schizophrenia, they are mostly dopamine 2 antagonists rather than dopamine 3 antagonists. So Watson et al. Wanted to do the study to see if dopamine 3 can actually play a role in helping find more efficient medication. So they hypothesized this from their rationale, which basically they found that antagonists stop the activation of D3 receptors, so they won't be able to release too much dopamine, or in this case, probably any dopamine at all. And they found that in mesolimbic pathways, which is involved in our reward pathways, which is part of the dopaminergic system, is very important because it helps us with our learning and our thinking and our experiences. And so they felt that the antagonists of these D3 receptors will actually enhance our thinking and experiences and stuff. So to start off, their methods was they did 3 different Lister rat groups. And the reason that they use rats is because rodents have behavioral phenotype changes depending on the type of environment that they're in. So if they're in their regular environment, they have their regular actions, but if they're put into an alternative environment, then it's typically easier for them to have behavioral changes. And they were also used because rats' behaviors are seen to be very similar to behaviors that are in humans, and rats are also actually more social than mice are. And that's why we would use them, because humans are considered a social species. So they did a group house versus isolation reared in these Lister rat groups. And that's basically because rats typically live in groups. So they wanted to see if the antagonist will have an effect on them if they were in their regular environment with no schizophrenic symptoms induced. But they also did an isolation reared group because social isolation actually caused cognitive impairment and hyperactivity, 2 symptoms that I have mentioned are a part of schizophrenia. So they did one group that was group house to make sure that no schizophrenia symptoms was induced to see how the antagonist will make them react. And then they did one that was isolated to which induced schizophrenic symptoms to see how the antagonist will react then. And they were put into these groups for 6 weeks before they were injected with these 3 different type of antagonists. So the first one, which is the very most important one that they're trying to see if it will play a role in reducing schizophrenia symptoms, is the D3 selective antagonist. And it's very hard to make D3 selective antagonists just because just because D3 receptor structures are very similar to D2 receptor structures. So they use 0.4 and 0.16 milligrams and kilograms of this. And then they also use a preferential D3 antagonist, which is mostly used when people are studying D3 receptors, but these antagonists target D2 and D3 instead of specifically just D3. And they use 0.16 and 0.63 milligrams and kilograms of this one. And the last type of antagonist that they used is the preferential D2 antagonist. And this is the one that I mentioned is mostly studied when it comes to schizophrenia. So they wanted to put that in there to see if it'll have an advantage over the D3 selective because it is mostly used in schizophrenia. And in this case, they only use 0.63 milligrams and kilograms of this. Now there's another group that they use, and it's another D3 selective antagonist, but they call this the vehicle D3 selective antagonist because unlike the other groups, it was not diluted with saline. The other three groups were diluted with saline just to reduce the potency in them. And they did one without the saline just to see if strength of potency plays a factor in how it works as well. So one of their methods that they used, a test, was the horizontal locomotor activity, which basically each time the rat would move inside this little box, a light beam will shine and it will record the time and position of the rat. And it'll show the starting point and it'll show where they ended up at. And they did this over a total of an hour. And this just showed the total movement of the rat over time. And this is a very good test just because locomotor hyperactivity is equal to psychotic agitation. So in schizophrenia patients, they are seen to be very agitated when they are active too much, when they're all over the place, their thoughts, their actions, their movements. So they wanted to test this, and it was basically seen that if the rat moved too much, then the antagonist didn't really work. So these are the results for this test, and I split it up into the three different groups that was used: the D2 antagonist, the preferential D3, which is the mix of D2 and D3, and the selective D3. So on the y-axis, you will see total beam breaks, which is basically just the total that each time the light beam shot through the horizontal box, just the total movement over time of the rats. And on the x-axis, it has the group housed versus the isolated, and it just compared the vehicle D3 selective antagonist, which was not diluted in saline, versus whichever group they were looking at the time. So for the first graph, they compared the group house versus isolated, and the D3 selective that was not diluted in saline versus the D2 antagonist. And the only significant beam breaks that was seen was in the isolation group that was injected with the D3 selective that was not diluted in saline. In the D3 antagonist that was a mix of D2, it was seen the same way. Only significant one was the isolation group that was injected with the vehicle D3 antagonist that was not diluted in saline. And for the selective D3 antagonist, it actually showed that there was significance between not only the isolated group that was not diluted in saline, but the isolated group that was selected D3 that was diluted in saline. So it showed that D3 actually did play more of a role than D2 did. So basically, they just concluded that all three of them showed decreased hyperactivity in isolated rear rats. The group house rats didn't have much of an effect in this test at all. It was mostly the ones that was socialized. Now, another method that they used, or another test, was the novel object recognition. And basically, this test evaluates your recognition memory. So because rats tend to explore new objects, which means that they love to learn and they memorize objects, they put them in a box and they had two familiar objects with them. And when it came to testing day, they took out one of the objects and added a new object and seen if the rat was going to explore the new object or if they were just going to keep with the familiar object. And the discrimination ratio in this case is just to see if they are sensitive to memorizing certain things. So they did this test for 2 hours. And basically the y-axis shows the discrimination ratio. And basically if the memory sensitivity was lower, then the recognition memory sensitivity was lower, then they recognized the familiar object and didn't pay much attention to the new object that was shown. So in the D2 antagonist, it showed that both the social and isolated rats that were injected with the D2 antagonist actually did not discriminate against the new object. They actually did explore the new object. And it also showed that the isolated group that had the D3 selective antagonist vehicle that was not diluted in saline was also significant, was not discriminating against the new object. So they explored the new object. And the D3 antagonist that was mixed with the D2, it showed that the only significant one was the isolated group that had the vehicle D3 selective antagonist that was not diluted in saline. And then for the selective D3 antagonist, it showed that all the isolated groups actually had a significant approach. They did not discriminate against the new object. They actually explored the new object. And so it just goes to show that the isolation group, when it comes to D3, D3 is effective when schizophrenia symptoms are induced. When schizophrenia symptoms are not induced, D3 does not have much of a role. So basically, they just concluded from this test that all three tests actually helped recognition memory in the isolated reared rats, and the D2 showed some type of help in the recognition memory with the group house rats, but not as much as it was shown in the isolation. So basically overall, Watson et al. Believe that D3 receptors can actually be useful when it comes to finding more effective medication for schizophrenia. So this gets into more of the treatment for schizophrenia. And basically, schizophrenia is treated with antipsychotic medications. And antipsychotic medications actually decrease dopamine, and they're mostly D2 antagonists because that's what scientists have studied mostly, not D3. And they're given in high and low potencies. And people typically, when they're on these medications, have to take them lifelong. When they don't take them, like if they're taking them and they just abruptly stop taking them, then they can actually cause their schizophrenia symptoms to become worse. Or if they actually take them for too long, they can have really bad side effects with them. And then when it comes to cognitive behavioral therapy, which is another treatment for schizophrenia, basically it just gives skills training for the behavior in schizophrenia patients. It helps them with employment, going to school, forming relationships. So just think of someone there helping you with everyday life activities. And these people typically have to have regular treatment, like once a week, 3 times a week, every day, just to not relapse or end up in a hospital. And most of the time, this therapy is combined with medication. So it's another lifelong treatment. So another article that I found, Cortez et al. Actually wants to help find a better medication so these schizophrenia patients don't have to take something that's lifelong or something that can cause their symptoms to be worse if they don't want to take it, or something to cause side effects. So they found that cannabinoid type 2 receptors actually help in regulating the release of dopamine. And they believe that CB2 can actually help modulate dopamine releases in the brain, so too much dopamine is not released and possibly not cause schizophrenia symptoms in people. And basically, this is just another new research for treatment outside of D3 antagonists. And basically, I just want you guys to take home 3 points, which is that schizophrenia is a mental illness and it's caused by excessive dopamine activity. And Also, that medications to treat schizophrenia can be considered dangerous. Like, they cause side effects, they can cause your symptoms to become worse, or they can even become ineffective if they're taken too long. And the last point is that cannabinoid 2 receptors actually can be the basis for more effective medication along with D3 antagonists. These are my references. And I just want to thank you guys for watching my talk. And of course, let me know if you have any questions.